Well, good morning. My name's Taylor Randall, Dean of the David Eccles School of Business, and it's my pleasure to welcome you to this installment of our Navigating COVID-19 series. We're pleased to be broadcasting this throughout the state of Utah and beyond, thanks to a generous donation from the George S. and Dolores Dorey Eccles Foundation. We're coming to you from the Mariner S. Eccles Institute for Economics and Quantitative Analysis. Mariner Eccles was a very important figure in the economic history of the United States. He was the head of the Federal Reserve, and his policies brought us out of the Great Depression as a nation. We're pleased that this is an intellectual partnership between our faculty and the great people at Levitt Partners, as well as the Sinosure Group. Today, we're going to be talking about key insights that you need to focus on in the planning the next 3 to 6 months to a year, what you need to look at. We're glad to have today as our host, former Governor Mike Levitt. He's also the former Secretary of Health and Human Services for the United States. Mike, why don't you take the microphone from here?
Well, Dean Randall, thank you, and good morning, everyone. Today's word is titrate. Titrate is the process of measuring or adjusting the volume of a medical intervention. Most of us will have had some experience with that. If we've either had or know someone who's had a condition that required some pain medication, there was some titrating that went on to make certain that we had the right dose at the right moment. We were undoubtedly told that there are some side effects that can occur with this medical intervention. If you use it too long or you use too much of it, some not so pleasant things can happen. So today we're going to be talking about, of course, COVID-19. COVID-19 is a chronic situation, meaning it's going to last a while. Social distancing is a medical intervention, and like other medical interventions, it can have side effects. In some cases, we've now seen side effects economically, profound ones, because we have used it for a period of time, and we have to get to the point that we can no longer use some components of it. There are sociologic side effects that have begun to occur. We're seeing certain trends in our environment that cause us to worry that the side effects of this medical intervention called social distancing, it could be causing more harm than it is good. So we have to titrate. So today's word is titrate. We're going to talk about how we balance the side effects, if you will, of this very important innovation and the impact of the virus. Now, it should be acknowledged that we've had very good success as a state. We are doing well. It doesn't mean the virus isn't there. It doesn't mean we still have a problem. We do, and we have to manage it. And today we're going to talk about the way we manage through this chronic situation and continue to see our businesses function and our lives begin to, I think the word we're using is open up. Today we're going to talk about the process of the next 90 or 60 or even 120 days. And you'll hear words like flare. A flare is a term that we're now seeing applied by public health officials as they talk about situations where the virus may begin to spike suddenly, requiring another medical intervention, some form of more intense social distancing. Or hotspot, that's when it's going to get very serious and could go to the point of actually outstripping our medical resources. That's when people are seriously hurt. Or we'll talk some about transmission rate. That's the rate at which one person gives it to others. Is it one person to one person, or is it one person gives it to 4 people and those 4 people give it to 4 more people? Those are dangerous situations. Right now, it's hovering right at, or in some cases, under or just over 1, which means we're right on the verge of being able to see it begin to diminish. But if history is a guide, what we'll see is that it will at times begin to tick up. Now, we know that the heavy medical intervention, the social distancing, we may have outstripped to a degree our capacity to do that again. And so we're going to have to learn to manage this, to titrate our activity. So today our conversation is going to be all about how businesses can learn to use key indicators to titrate their activity. We'll talk a bit about where you can go to get information. We'll talk about what conditions you should be watching for in order to titrate the way you respond in your business. So we're on to a new part of our conversation as a society, our experience. This is a period for us to not abandon, but to rebalance and to learn. And that learning will start today, and we're glad you're here. Let's talk a little bit about our agenda for the day. First of all, we're going to be hearing about data that you can use and how you can use it. We'll be hearing from Dr. David Muhlstein, who is the Chief Strategy Officer and the Chief Research Officer at Levitt Partners. We'll also be talking about building your playbook. John Pullman, who is a Senior Director at Levitt Partners, has been heavily involved in creating much of what has gone into our state's planning effort. Then we'll hear from two very well regarded businesswomen from our state. Natalie Cadiz will be here. She has the Cadiz Enterprises, and also Crystal Magnalet, who will be here, who's actually the chairman and CEO of FJ Management. Now, I want to say, as always, this is going to be an open discussion. We're going to have a period at the end where we want to have questions. You'll notice at the bottom of your screen a chat function. And we're going to have all of the panelists available to answer questions at the end. So we're counting on you to remember to ask those questions through the chat function, and we'll continue this process of learning. So now on to our first presenter. This is David Muhlstein. David is the Chief Strategy Officer and the Chief Research Officer at Levitt Partners, well thought of around the country. And David, we're glad you're here to help us learn how to titrate our activity.
Thank you, Governor. It's great to be on today, and I'm excited to talk a little bit about some of the data that we're seeing and how it can be useful for making decisions. I'm going to start with just a national viewpoint, and this is showing the growth of cases over time. In the orange line, you're seeing the total number of people that have been diagnosed or confirmed positive in the United States. And then the green line is showing the number of active cases, and then the line at the bottom is the number of deaths. Obviously, we want to make the death line as slow growing as possible. But the number that we need to be looking at and paying attention to is the green line. This is the number of active cases. This is how many people have it. And as you mentioned with titration, how many have the possibility of infecting others. As we go to the next slide, you'll see the growth rate over time. And this is where we can look at how many people are being infected for each person that is currently has the disease. So as we look at that, we see that there are a number of, or that orange line has dropped to around 1. When we are at 1, we stay relatively stagnant. If we can go below 1, we will see a consistent decrease in the total number of people that have the disease. As we go to the next slide, we'll now be able to overlay this with Utah. Now, Utah is important because it gives us a chance to see how the local performance is. And one of the things that we will see is that Utah has largely mimicked the national trend. Obviously, with a smaller state, it's not going to be as smoothed out, but we are seeing that there have been trends. One of the trends that you'll capture right away is that we got below 1. We were at the area that we wanted to, and then we went back into the positive range, where about 1.5 people were being infected for each person that had the disease. And now we've gone back down, and for the last few weeks in Utah, it has been below 1 again. What are the policies that keep us at that line, or hopefully get us below that line, while, as Governor mentioned, not providing too many conflicts that we need to address on the well-being of the state. On the next slide, we can start to see where Utah compares to the nation. And this is looking at the count of active cases. What you'll see is that Utah is pretty much right in the middle, between 1 and 2,000. As we go to the next one, though, we get to see where the growth is. Again, growth, Utah is right in the middle. It's in this category, what I would call minimal change. We have approximately the same number of cases today as we did yesterday and the day before. For everybody that gets better, one other person is being infected. What you'll also notice is that many areas in the country, though, are in the growth category. And this is the area that we don't want to see states in, we don't want to see people in. And this is happening for many different reasons, many of them unknown. But it's at an observation standpoint, we see that growth is happening in more areas of the country than not. On the next slide, we get to see how Utah has performed over time. And this is looking since we first got granular data on the state at the end of March. If you start in the bottom right-hand corner of this slide, it shows on March 25th that Utah had a growth rate of about 3. This means for every person who had the disease, 3 more people would be infected before they got better. But it was also a relatively low number of cases that were happening, below 500. As you follow that blue line, you see that we have consistently gone upward in the number of cases, but we've also decreased our growth rate. And over the last 3 weeks, we've been relatively consistent with around 2,000 cases. Most recently, we're just below 2,000 cases. And this is where Utah has been. And you are familiar with the policies that have been enacted, the level of risk that we're at. But as we think of it from a standpoint, we have started to hover right around that 1 level of transmission rate and stayed static with about 2,000 cases over time. Now, when you try to make a decision, you can't make a single decision for the entire state. And in our next slide, we see the number of active cases on the left and also the level of growth on the right. You'll see that the southwest part of the state has no active cases right now. Relatively little concern there in terms of growth. But on the right, we start to see different trends or different growth rates that are playing out. While Salt Lake County has the highest number of cases, it's relatively static, not a lot of change. And Utah County is actually going down. But we're seeing up around Davis County start to be an increase in growth. One to call out here is San Juan County. San Juan County has had significant recent growth. The Navajo Nation as a whole has a higher percent of the population that has been diagnosed with COVID than New York City. It is the highest prevalence of the disease in the entire country. Obviously, though, policies that address San Juan County could be different than those that are affecting the greater Salt Lake metropolitan area. As we look at counties over time, in the next slide, we can see where things have played out and where the burden is in different parts of the state. Going back to March 25th, you see what percent of total cases appeared in any one county. Salt Lake has had a large percent of cases over time, but in the early days, Summit County had a disproportionate number. Then Utah has started to pop up, and then San Juan, which has a very small population, now has a measurable percent of the total cases within the state. As we think about monitoring this as a business leader, you need to understand a number of different things. First is that these differences are going to be local. You need to understand what's happening within your local community, but also understand that these trends will play out where your suppliers and your partners tend to be. There needs to be a certain level of planning for what I call the whack-a-mole phenomenon. This is where there are going to be hot spots where you need to change what's going on within a local community, have increased distancing, potentially close down areas. And then as they get better, they might be able to open up again. But all communities are at risk of being the mole that pops up and need to be whacked back down. And so knowing what's going on within your community is important, as also as your partners, what's happening in their communities. We also need to understand the beginning of any of these trends. So if we think of a wave that is starting to come up, you need to understand when that wave is starting to form. On the last slide, I want to look at a 3-week projection of 2 different regions within the state. One is Salt Lake City. we're projecting very modest growth in Salt Lake. On San Juan County, on the other hand, significant growth is starting to appear, and that's because of these trends that we're seeing because of the Navajo Reservation. The red dotted line is showing the capacity of the healthcare system to address the projected number of people that are admitted to the hospital. As you look at these lines, Salt Lake really doesn't have a concern, and for the next 3 weeks, we're not projecting a concern. San Juan, though, needs to be aware of this and look at where there might be needs to address capacity or identify other interventions to see how we're going to care for the people that are projected to be sick. If you wait until we hit capacity, it's too late to plan. But if you can see that the wave is starting to form, then you're well positioned to create strategies and be ready for that. So in summary, Utah is relatively static right now, consistent of around 2,000 cases, but there are different hotspots, and we need to be aware of those hotspots and target our interventions to where there is a need for that. And as a business leader, it's important to really pay attention to what's going on with where you live and work, but also where your partners and your suppliers live and work, because it's likely that many communities will have flare-ups and need to be addressed, and that can impact your business going forward. With that, I'll turn it back to you, Governor.
David, thank you. I have a question. So I'm a business owner, or I lead an organization, and I get up in the morning and there's some things I look at. And I like to see what the sales were yesterday. I like to see how things are settled in my business. And I'd really like to have this information where I could look at it. Where can I get this data so that I can make these judgments?
This is a free resource that Levitt Partners has put out. This is just a screenshot that I've pulled from that, but it's covid19.levittpartners.com. And you can go and look at any county, any metropolitan area, any state, or actually any hospital in the country to see what the 3-week projection is. So just go in and look for it.
So let's say I started to see that transmission rate that you talked about, and today it's about 1, and let's say we get into August or September or early October, and suddenly I notice that it's no longer 1. It's now 1.5, and then a week later it's 2. What does that mean?
This is the fear of the second wave. We don't want a second wave, but if history is our guide, second waves are very common in pandemics. And knowing when that is starting is going to be imperative. It's really impossible to project it. We could speculate and say it's going to happen in Utah in October, but nobody has the ability to do that. But if you monitor this and start to see the transmission rate creep upward steadily over a multi-week period, that could be indicative that the second wave is coming within our region.
So give us the link one more time, and you said it's free.
It is covid19.torchinsight.com. I may have missaid the first time. It's covid19.torchinsight.com. We can also type that in the chat so that people can see that.
Good idea. Well, thank you, David. Great presentation. Let's now go to John Pullman. I introduced John earlier as the Senior Director at Levitt Partners, who is going to talk to us about how you can use this kind of data to titrate and to develop a plan. John.
Great. Thank you, Governor, and thank you, David. I'll restate again, we have Optimism, and Utah is really making great efforts to stay in yellow. But as David has shown, there really are scenarios, and they can happen quickly, where there's going to be a temporary move back to orange or maybe even red. But what's different from what we've experienced from March through now are 3 things. 1, these outbreaks are more likely to be local, not statewide or national in any type of a shutdown. They're also likely to be shorter in duration. And 3rd, we can plan and be prepared in a way that we weren't in March, and we can weather this in ways that we couldn't before. So our mantra is that we cannot predict with perfect knowledge. We can watch the signs, but we can't prepare. So what can you as a business and organizational leader do to weather the potential storms that could come? Here are 5 ways. The first is, in your organization, assign a COVID-19 leader or a committee who's responsible for workplace impact. These are the people, the person or the people who are going to make sure that you are watching the signs, as David mentioned, and there is no ambiguity of whose job it is to make sure the company is both taking the right measures in the current environment among hygiene and social distancing, but also to be ready under changing circumstances. Make sure that person has a team if they need it, or they have access to the right people to conduct the other following activities. So the next one is for that group or that individual to be monitoring government and industry activities, which has been stated before. There's a lot going on, and it's not just about predicting what's coming in your state or in your area, but it's also where your suppliers are, where your customers are. It's a good idea to follow the latest on state guidelines. I sit on a committee that meets every Friday morning to review the color-coded guidelines. I just got out of that this morning, and there will be a number of changes coming on Tuesday. Some will mean a lot to some people and others won't. But the point is, things are changing regularly, and you need someone who's watching and track that. In addition to watching what we're learning about the virus and testing and different ways you could be nimble in your organization and adapt in your own precautions. So the third is a big one, obviously. It's identifying your essential employees, your essential business functions, and the other critical inputs that you need, and create response plans to them. So of your employees who's truly essential, make sure you have plans for them. Prepare for absenteeism. This is not only sick employees who will stay home, but people who need to care for children or if schools are closed. Your business functions, determining what your outside activities are, what your business can do to maintain operations, what are the logistics of that, such as remote technology. Again, things that we can be prepared for now that we weren't before. Thinking of your critical inputs, your supply chain, what reserves you might want to stockpile, personal protective equipment, cleaning supplies, to-go containers for restaurants, and also recalling there could be shifts in the demand for your products based on how things evolve. And then creating response plan for each of these. You need to build a playbook and include in that an emergency communication plan with your key contacts and backups, your chain of communication and processing for tracking and communicating generally. Fourth is to educate your workforce about the threat of the pandemic and what the business is doing. And there's a couple reasons for this. One is you really want to give confidence to your employees in their personal safety and confidence to them in the durability of the company. I've enjoyed working at a company that's been very clear of the metrics that we are going to follow, which will change the behavior of the company and things we need to bring it back financially. That gives people confidence. It also helps them react quicker if a pivot is necessary. If people know what the plan is, then they can more quickly adapt to changing the operations and reduce as much waste as possible. And fifth is just establish and maintain an open dialogue with your communities. And your communities can include your associations or your peers. We've seen a remarkable amount of collaboration going on in the industry. Pharmaceutical companies, competitors coming together to collaborate. There are a lot of people trying to solve common challenges. A lot of people are dealing with this. I mean, people are dealing with this for the first time, and they're willing to share solutions that they're finding. So be network, learn what others are doing and learn from it, and share what you're learning with others too, and we'll all be able to weather anything else. So I think in conclusion, Governor, despite the positive trends, and we should be proud of the trends that we're seeing and be optimistic, but it's a novel virus and we can't predict everything, but we really can prepare. And I think with organizations putting a little time and resources, especially now as we're opening up, this will prepare them for those potential scenarios.
Well, thank you, John. I have a couple of questions. So you mentioned a couple of times supply chain. And a lot of businesses have now been able to open up, but their supply chain was interrupted. And so their inventories or whatever the ingredients they need for their business are in short supply. What I'm hearing you say is, let's see if we can't forecast that a bit and see some early warning, anticipate. Now, David shared some data that could be available. How would you use that kind of data availability? Let's say you had a supplier in Southern California, or you had a supplier in Chicago, or you had a manufacturer that even might be international. How would you go about being able to gather that data so you would have some ability to anticipate supply chain interruptions?
Mm-hmm. Yeah, and I'll be interested to hear maybe a response from our guests later on how they're specifically doing that. But some general principles is think of how long you might be able to last without those supplies. So we just went through an experience of about 2 months where there was a shutdown. And we hope this is going to be something smaller, not only if it happened here, it'd be locally or in your broader chain. So we'd be really looking at what is the demand over time, and hopefully doesn't need to be the 2-month elements that we were experiencing before. You want to monitor the perishables. What David's projecting is about 3 weeks, and that's a pretty good estimate for what we might know and seeing a trend of a flare up. So that's being watching of that window of how much time you would have to maybe reduce the perishable goods that you'd be ordering if things are headed in a certain direction, or to stock up in ways you'd hope to. That is a general challenge of this, though, is how do you keep your eyes in any area? And people that have supply chains, and that's an area in other states and across the globe, will have the biggest challenge, but that's where they should be putting their resources and attention to watching and monitoring of what might come.
You mentioned this could happen quickly. This can change fast. How fast can it change? And based on what we have observed in the last 2 or 3 months, how often should we be recalibrating our thoughts?
Yeah, I actually want to turn to David on that one. I think, I was this morning, I was reading about a report in South Korea of a studio, a dance studio, gym studio, and 112 cases came out of that in 2 weeks. Now, David can tell you what the exponential growth of that can be if things don't get contained. But it can happen quickly. And as we're opening up, I think this is the most vigilant we should be in watching these trends, because this is where we're really going to test the efficiency of the spread of the virus. David, I don't know if you have a comment on what you've seen with exponential growth and timing.
Yeah, I would suggest that you should be looking at this at least weekly. I think every week you can start to see trends. If you're really interested, it could be a daily endeavor, but at a minimum, once a week, you should look and see how the trends have started to change.
Well, John, thank you. And David, thanks for that explanation. Just a reminder, I'm not the only one who gets to ask questions here. If you have a question, go to the chat box, bring it up, ask the question. We're going to go to questions in just a minute or two, or a few minutes. We are now going to go to the next phase of our program, Natalie Cadiz. Natalie, we're so glad you're here. You run a really interesting Utah business. Why don't you start just for a minute and tell us about your business, because it's kind of novel.
Well, good morning. Thank you, Governor, and thank you to everyone for having me here today. As you mentioned, I'm Natalie Cadiz, and I'm the CEO of Cadiz Enterprises. And we are a second-generation family business, and we do thermoform plastics. So we make products to support the power industry, the electrical power industry. Our products cover and protect power infrastructure against animal-caused power outages. Now, what you may not know is that 25% of all power outages are caused because of animal interaction. And the economic impact of those power outages are billions of dollars every year to the US economy. So my goal is simple. We want to eliminate 25% of power outages for everyone globally. And some of the things that we've done since COVID-19 has taken place are really kind of focused with what Governor Herbert's mission was: adapt, innovate, and overcome. It was a very clear mission that I could wrap my head around. So that's how I went to my team with. And we started to adapt. We were identified as critical infrastructure. And although I was very grateful to be identified as critical infrastructure, I've realized my team was not, because they were fearful and they were worried. So we had to implement things to make them feel safe. We implemented twice weekly town hall meetings. We talked about the precautions that we were taking, as well as we had to collaborate on how to reevaluate our manufacturing process and our work cells. How could we create more distance between them? And as businesses around us started to shut down, they became even more fearful. We extended our health benefits to include mental health care. And that was significant because I think mental health is becoming more important than ever as the anxiety of the situation has changed. So we also innovated. We have a strategic plan, and through that planning process, we've identified some of our own strengths and weaknesses. And what we realized about a year ago was that we had a weakness in our internal systems, in our manufacturing enterprise system. So we made intentional investments into that. We launched that system on January 1st. It was a pretty steep learning curve. But then we were given the gift of time. So we took that time to our advantage, and we started learning the system and redeveloping processes. And again, we had to remap out our manufacturing flow. So how do we find efficiencies within our new work cells and our new flow? We trained our employees, and we also reached out to all of our customers to try to understand what their concerns were and how they were handling the situation. What we learned was that our customers were really focused on us, and were we stable enough to maintain the supply chain? Were we a stable part of that supply chain? And we made these commitments to them that we could meet their demand. We invested in our sales force. We started investing in professional development to move from a vendor situation into a partner. We want to be true partners with our customers. And we will overcome. We're starting to see some benefits from that. We're looking at our strategic plan differently now. We're looking at it through the lens of 3 months, 6 months, 12 months versus 3 to 5 years. And that's kind of we're making different plans for that. Whether that's financial, regarding our inventory, what do we have on stock, whether market diversification is now the right time to try to launch new products and go into different marketplaces. Again, we're re-engaging with our customers and with our team, and I'm confident that we will reemerge stronger. We have stronger loyalty within the families of our customers and our team. We're reaping the benefits of these investments already, and it gives me hope. It makes me feel very positive about where we're headed and how we're going to get there. So thank you.
So Natalie, that was a great presentation. You mentioned the phrase, we were given the gift of time. Right now, we're being given a gift of time.
Yes.
As we approach the time that we might see a second wave. What did you learn in the first wave that you'd like to do better, given the gift of time, in the second wave?
That's a great question, because I did look at it as a gift of time and really focus on how do we improve. One of our core values is continuous improvement. So how do I do that as a leader as well as an organization? And the examples that you've shared with us, that data helps us to anticipate what could come next. And then, how do we make sure that our employees, we're not caught off guard this next time? We have these processes in place. We have the adequate inventory. We have these kind of stop gaps, if you will, in place to do that.
Great response. Again, the goal of our session today is to talk about the ways we can learn and rebalance, and then learn to be able to titrate our responses as things begin to change. So we'll talk a little bit now with Crystal Magalud, who is, as I mentioned, the chairman and CEO of FJ Management. Now, Crystal, I'm guessing not everyone will recognize FJ Management, but I'll bet there aren't any people watching this presentation that have not been in one of your businesses or stores. Tell us a little bit about the nature of FJ Management and where we might have encountered your business. I'm not hearing you, and Crystal, you might have your microphone. There you go.
Thank you.
Believe me, you're not the first one to do that. We're all learning Zoom.
Thank you, Governor. And I'm very pleased to be here today. And I will start with just a little bit about our overall businesses that many on the phone may be aware of. Our first business was Crystal Inn Hotels. And my family business was Flying J, as well as Maverick, Tab Bank. We have a oil refinery. We have gotten into some healthcare investments. So we're actually in many, many different industries at this point. And so, as you can imagine, when the world sort of comes to a screeching halt, we had many, many different needs across our enterprises. And we had different circumstances, from our hotels being at 80% occupancy and 5 days later being at 20% occupancy, to our bank that doesn't have branches, that was basically business as usual, moving people to working from home. And these were stressful times for the people running our businesses. And the first things we did were knee jerk. We got everybody together and all of our different company leads, and we talked amongst ourselves about things. We brainstormed essentially what were the most essential things we needed to do for our employees and their families and our customers. And everyone had great ideas and came together to make those things happen as quickly as they could. We also have, you know, Maverick is a regional business. We're in 12 states. Every one of those cities, counties, and states were reacting differently. And we had to very quickly figure out how we could communicate best to help each of our stores. This became mostly a bottoms-up type of communication, where our stores would notify our government relations department, who would then verify what was going on in those particular cities or counties, and then get with operations to make sure things were handled in an adequate way. And is we also had to learn to become very flexible. You know, we, like many companies, have our annual plans and goals, and everything was going amazing. We had an amazing almost first quarter. And when the bottom dropped out the middle of March, I saw our companies do amazing things to be flexible. Tab Bank, one of their business areas, wasn't doing well. They took on doing PPP loans, which we were able to divert some of the staff and avoid layoffs. Maverick put pay in place to help people who were going to be coming to the stores, put increased pay in place, as well as they took one of their ideas that they hoped they would do eventually, curbside delivery and online ordering, moved it to the top of what they wanted to do, and we'll be putting that out sooner. Our hotels, that occupancy continues to be low, have kept people employed by having them do deep cleaning and organizational tasks. And I think that if we had not had to learn to adapt to all this change, we wouldn't have been able to put some of these things in place that actually long term will make us a better organization. I think that really resilience has been something that's been extremely important as we have gone, and being nimble and resilient is what I know our organization has had to get better at. We have COVID response teams in each of our companies, and hopefully they are doing what John and Dave were talking about, looking at reports, anticipating what's coming, hopefully getting ahead of that. We actually are putting in written contingency plans with metrics to monitor, so that when these metrics are hit, that we know what our plan is going to be, so that we aren't doing knee-jerk sorts of plans. I don't think that there are many people out there, and I'm sure there are some, but I know we were not one of the companies who had planned for a pandemic. I can say that we anticipated recessions and things like that, and would think through what that would be like, but I don't know that that was in our plan. I think that it really, in the end, that the most important things that you can do in this situation is communicate and to plan. And with that, Governor, I'll turn it back to you.
Thank you, Crystal. Really good advice. So Natalie used that phrase, gift of time. I like that. And she reflected on the fact that we have a bit of a gift of time right now as we begin to approach that period of time where we worry about this second wave. I'd be curious to hear you reflect a little on what you have learned from the first wave that you would like to do better in the second wave and how you're going about it.
I think it really does come back to what I just mentioned in planning, because I really think there are ways to put metrics to some of the things that are going to happen. How bad, for instance, the economic downturn could be, and what would we do in those situations. And so that is something we did not have, right? We didn't have the luxury of thinking that through ahead of time. It was mentioned, what about suppliers earlier on, and making sure that you have a backup supplier, or that you have a different, in our case, a different product altogether, that you're able to anticipate. What if, something, there was some sort of over-the-counter drug, for instance, that came out that was helped with symptoms. How could we get that for Maverick? What suppliers that we maybe don't even have relationships with right now could we quickly go to and say, hey, this has happened, do you have this available to us? So making new relationships and just trying as best we can to anticipate what our world would look like under many different scenarios and putting plans together around that.
Well, speaking of planning, clear with the number of businesses that you have who look to you for direction and to whom look to you for accountability. Most of them will have had a profit plan for the year and with the revenue goals and the other kind of components. And then you mentioned flexibility. How are you managing that need for flexibility, but keeping people still motivated to do the best they can?
I think we are just supporting people's new ideas. I think people know in our company, we have a very strong culture of families helping families. And I think our employees want to make sure we still perform. And they know what those metrics and goals are, and they know what profitability we were expecting for the year. And they are giving it their all to come up with new ideas, which we're encouraging and asking for. How do we do this? I mean, I certainly cannot be the only one dictating what all our companies are doing. I have extremely strong managers and presidents at all of our businesses who are looking every day and empowering their people to help come up with new ideas to make sure we get as close as we can to those budgets we had for 2020. I mean, we can't get there, but we can keep working there and keep trying to get there and adapting and changing. And that's what we've got to do. We've got to just keep adapting and changing to this crazy world we're in right now.
That's a really good and wise advice. So it now is time for us to involve all of you. And we hope that you have been adding your questions on the chat function at the bottom of your screen. To the extent that you haven't, there's still time. And I'm going to now turn to Andrea Thomas, who is going to lead a moderated questions and answer session for our panel. And Andrea?
Thank you, Governor Leavitt. The first question is for David. It seems like the reality of the pandemic was much less dire than it was originally projected. What does that mean for the concerns of a resurgence in the fall? Are those more dire, or what are the things that we need to be planning for and thinking about?
It's a great question. When we looked at the original projections, that was what would happen if no interventions were put into place. And so thankfully, what we've seen is that the interventions and the trials that we've all gone through for the last few months, there is evidence, empirical evidence, that they are working. And so that's the first takeaway, is that those projections were based on not doing anything. The question about going forward is, if there is a second wave, will we do something again? Would we be willing to close down the economy, to limit social distancing, all of these different things, and at what level? And so I would say we still need to be cautious, we need to be observant, and there is always the risk of exponential growth. Our greatest solution to this is if a vaccine is successfully invented, but until then, we need to monitor it and hopefully avoid that dramatic exponential growth that's really hard to stop.
Great, thank you, David. This is for the entire panel. What would you say to people who are nervous to return to work now that things are opening up a little bit? If they're essential to your business and their work can't be done remotely, can you require them to come back to work even if they're nervous about it?
So why don't we turn to Natalie and Crystal first, and then we'll invite others to comment. Natalie?
Yes, that's a good question. So because we were deemed essential, all of our employees and we're manufacturing, we can't do that remotely. So what we did was, as Crystal mentioned, we did some brainstorming with our team. What would it take to make you feel comfortable? What is it that you need? So we identified that we needed to source PPE. Again, we changed our manufacturing processes to spread things out. We had some excess space. We weren't running at 100% capacity, so we were able to take that time to do those things and implement those protocols as well as the cleaning measures. I think once we started communicating really clearly with the team on what we could do, what we had access to, they became more comfortable.
Crystal, any thoughts?
Sorry about that. Yes, I think for us, it has been a little bit difficult on that front because with the Mavericks, people are encountering it's you've got to have everything in place, and it took us a little bit to get everything in place. Now we have and have for actually several weeks have hand sanitizer and masks for our employees, and we also put and I mentioned this a little bit, but we put premium pay in if you're the one on the front line. That's what we've done at the Mavericks, which I think they are our most at-risk employees. Honestly, we have not been able to satisfy everyone, and we've had people quit because of it because they can't get comfortable themselves. And I think that you have to. That's part of that planning. You've got to anticipate you're going to have people who, no matter what you do to help them get comfortable, they're just not going to get comfortable, and they're going to make decisions that will impact and potentially leave your business, and you're going to have plans to replace people if that's the case, and you do everything you can. For our people working from home, we see no reason at the moment anyway to bring them back. They've done great. They've proven that they can be productive, and because they have shown us that they can do that, we're going to allow them to keep working from home, but we don't have that luxury with each of our businesses. And again, each of our businesses is a bit different. So, our refinery, where we really need to keep everybody very helpful, we don't have as much backup as we would like. It's critical that we really educate people on how to stay safe and healthy. So it's kind of different across the businesses, but.
A really good response from both of you. We had an interesting session during this series where we talked a bit about how that can be done. We concluded that just like the two examples that we've heard already, that communicating is important, giving people the tools that they need. And a third is learning how to use symbols that demonstrate even deeper than words that the business cares and that the business is a safe place. We talked about grocery stores that were sanitizing all of the shopping carts. That was a symbol. We talked about restaurants who enacted similar kinds of measures where people could, both employees and customers, could have that confidence. So really interesting question. Thank you. Let's go to the next question, Andrea.
Okay, great. This is a follow-up question for John. You talked about the emergency response and communication plans. Are those separate from the COVID response teams? How does that all work together?
No, the ones I referred were independently created by companies, and these are not required in the same way those or the formalization in which those other communication plans come out. this is really the personal interaction of the employer saying, this is our plan. This is our plan to take care of the company, our plan to take care of you, to take care of your families. And that really can be customized to different organizations. The state has put out some general best practice guidelines for employers, how to keep things safe. And I think referencing that, the CDC has some information as well, which we've derived it, can help you build the plans of what you're doing, and then take the method to communicate to your employees and to your patrons in those instances where it's appropriate, how you're going to do it in a way that's familiar with them.
Great, thank you. David, what needs to occur for states to open up to out-of-state visitors? There's a lot of travel that businesses have to do, and also tourism with people traveling into state. Is that going to be back anytime soon?
So a few things that I would be looking at. So one of those is just the overall prevalence of the disease, where people are likely to be traveling from. So if we look at domestic travel, when we see that there is a diminishment of active cases across the country, then that suggests that we're going to be less concerned with people coming. I think an important part of this, there's two aspects. One is just how do you get people comfortable with the concept of travel again? And I think there's a variety of ways that you can do that. But even if we're open for business and it's green, there are going to be lots of people that just aren't willing to travel this year, and they'll put it off. The second one is that travel can be quite safe if you follow the same sort of standards and protocols that are in place. And so how can we encourage the types of travel that are less likely to lead to contagion or to transmission of the disease? I think all of those are questions that can be considered.
Thank you. Another question for actually anyone on the panel. History suggests that we will likely face additional waves. What are you doing as part of your messaging to set the right expectations for your teams?
John, I think that'd be a good one for you. You've been giving a lot of thought to how we stratify risks so that people know what the risks are. There's been, as Andrea points out, history says we're likely to see periods of increased activity. What are your thoughts?
Yeah, it's an important one, and I think, to David's point, some of it is just looking at the data and helping people understand that this isn't a subjective virus. We're dealing with science, and some of the things that we've been doing at Levitt Partners is really coming up with the protocols, and the state is doing this too, based on the behavior of the virus. We can't. We have to be responsive to how it behaves, how it spreads, how we prevent it. And so the elements I think that we need to do in these areas is just be conscientious of what we can and can't do, and be responsive accordingly.
David, do you have any comments on that?
So I think being transparent with what we expect might happen. So we have potential plans, not that we want them, but we are aware that they might happen. And then proactively discuss what would be in place. I think this is that messaging component, which says none of us want a second wave, but if there is a second wave, if there is the economy being shut down again, this is what we're going to do, and be ready to operate and act on that. This can be everything from what we do with our business, opening and closing different portions of that, to what's the expectation for employees. Maybe employees have previously been furloughed, and you have to set the expectation saying, we don't want this to happen again, but it is possible, and this is how we're going to perform. So preparing for the worst case, and even maybe it's not the worst possible, but preparing for contingencies and communicating those in advance.
So David used the phrase, let's be transparent about what could happen. The circumstances of my experience with pandemics while I was Secretary of Health, I studied pandemics going clear back into beginnings of recorded history, as much as could be ascertained. And it becomes very clear that in most pandemic situations, there is a second wave, and sometimes a third. What's also evident is that people handle the second wave better than they handle the third. And hopefully, as we all believe and have optimism for it, there'll be a vaccine. Now, that doesn't, as I have said, it's my view that there's a limit to the way we can use this medical intervention we call social distancing on a mass or a group basis. The economic damage has become evident, and people are just needing to be on with their lives. We're learning a lot more about who is affected most and how we can avoid it. We're learning about, as David said, the behavior of this virus. It is a cunning enemy that can hide, and we're now learning its secrets, and we'll get better at this. But I think it is important that people realize that the chances that we'll begin to see these flares and hotspots, they're very real, and that this requires us to give this thought. And just our optimism and our sense that how can this happen isn't going to change. Not even Congress can ward this off with legislation. This is science. Andrea?
Yes, question about exposure to risk when you have people coming in from other states. So specifically, this viewer works in a museum and they're seeing tourists coming in from across the country and they're having higher than normal attendance. So they're worried that they're at higher risk. Do you have any advice for them? Are they going to now be considered essential workers? Should they approach things differently now that having people coming from out of state is increasing their risk?
David, I think that's right in your wheelhouse. I'm sorry, I was thinking John. John, that's right in your wheelhouse. And David, if you have comments, we'd love to hear them.
Yeah. No, this is an area in which I believe for the time being, it'll be left up to the individual organization to determine if how they want to behave. Each organization can determine how many patrons they let into their institution, and they should be very thoughtful, square footage, ability to maintain that social distancing. I think those organizations, those are especially experiencing travel. The other element to do is just to communicate to those patrons what are the rules and guidelines within their institution. It is still possible for infected individuals to go around and behave. We don't want them to, asymptomatic or infected or symptomatic. But with the proper protocols, cleaning, social distancing, it's all there to protect it. So if institutions are helping set those rules, communicating to them as those patrons come in, and doing whatever they can to help individuals abide by them, I think they really can, to the best of their ability, be safe and continue to function.
Oh, thank you, John. I think, Andrea, that our time is quickly coming to a close. I'll just remind us all that today's word was titrate. We're dealing with a chronic situation. There are limits to which we can apply broad group behaviors. And so we're going to now have to, without having substantial side effects. And so we're all learning now to deal with words like flare, like hotspot, like transmission rate. And we learned today that there are places you can get information that will help you make a playbook for your business and titrate your activity. So with that, I'm happy to go back to Dean Randall and thank all of you for your participation today.
Thanks, Governor Leavitt. Thanks for being such a gracious host, and thanks to our panelists today, and thanks to you viewers for also being here as well. Next Friday, we're going to be taking an intimate look into state finances and how our state leaders are keeping a steady ground underneath us so that we can actually operate successfully as business leaders. As always, keep your wits about you. We're getting through this together. Thanks for attending today.